Kenyans at the Central Business District here in Nairobi. So I go back to Daktari, and you've had, Dr. Godi, you've had what Kenyans have said. BBI is not the important thing that the government needs to be talking about. We should be talking about the welfare of you doctors.
I completely agree. And you see, even as they talk about BBI, they removed the Health Service Commission. And the reason why the healthcare workers wanted a Health Service Commission is that we appreciate health is a very big function. And because we've seen that there are 47 counties and 47 different interests, and they are choosing to victimize their healthcare workers, we've decided that let us take human resource to the national in the Health Service Commission, and then we can leave the infrastructure to the governors in the county so that they can handle the hospital and the reagents and all those things. Why are we saying that we need human resource at the national government? Because we need equitable resource distribution. For example, in Kirinyaga, we only have one Hon.Gs that takes care of the entire population. But in Nairobi, we have over 2,000 Hon.Gs. Do you see that? That resource distribution is ridiculous. When we have the Health Service Commission, we are able to take the catchment area, how many people are there, how many doctors are required, how many specialists are required, and then we are able to distribute those doctors equitably so that we are able to give Kenyans proper health care. And it's actually in keeping with the president's dream of UHC, because we cannot get UHC if you don't have proper human resource. Proper human resource is the backbone of HSC and UHC.
But then, Dr. You're talking about the Health Service Commission.
Yes.
And this same Health Service Commission is what doctors are concerned about. They're saying the Health Service Commission they've been given in that BBI proposal is not the same Health Service Commission they had proposed when they appeared before the BBI team that was collecting views from Kenyans.
Yes. We want a constitutional HSC, like the JSC, like the TSC. But what they gave us is like a committee sort of, and that's not what we want. We want a constitutional HSC that is independent so that we are able to curb all this bureaucracy we have. And as we speak right now, HSC has completely been removed from the BBI. It's not even there.
All right. And you know, Kenyans right now are talking about issues to do with COVID-19, the welfare of doctors. But then, as much as the country is focusing on the COVID-19, pandemic that is ravaging the entire world, the people were saying that we are forgetting about these other patients who have probably cancer, HIV and AIDS, who have, other ailments that have been killing people globally day in, day out. What are doctors saying about this? Is the government putting more focus on that?
Unfortunately, that is also something that we've been complaining about. Even with the rollout of the UHC in places that had non-communicable diseases, even in those hospitals, especially in Central, you will find that you cannot consistently get drugs for diabetes, hypertension, and those are the major killers, the heart diseases. So even now that we have COVID, it's not a shock that we are not ready. We are not even ready for the diseases we've had for hundreds of years that have been researched on, that have vaccines, that have medication. We don't have adequate medication for that. And we have a lot of vulnerable people, HIV, pregnant mothers, cancer survivors, cancer patients, people with non-communicable diseases, lung diseases, asthma. I mean, the list is endless. And as I say, just because we have COVID, the other diseases have not gone on a break. In fact, COVID is only making those diseases worse, and the mortality rate in the hospitals have gone quite high.
All right. And so just recently, CS for Health Mutahi Kagwe, appearing before the Health Committee in Parliament, gave a directive that KEMSA is supposed to release the PPEs at market price so that doctors can get them. And this afternoon, I'm getting a message that the CS is expected to tour the KEMSA warehouse in Embakasi where PPEs are being held and later on address the media. But KEMSA, on the other hand, says they're still waiting for a written directive from the government itself, that is through the Ministry of Health, to write a letter to tell them, you know what, release the PPEs to the doctors. So it looks like the government itself is not committed.
Yeah, you see, this is what I'm telling you. This is the cat and mouse game that we are tired of. We are tired. The government, it's the same government, it's one entity. So now KEMSA wants the CS to write a letter, then they also don't have the PPEs. I feel like we have already lost so many doctors. Which more directive do you need? The cabinet secretary has given his directive. The CAS of health also said it. Now they want a letter. This is what we are saying, cat and mouse game. They take you round and round in circles. And these PPEs that they want to release at market price, my question is, these were donated. We were given for free. You're giving it to patients at 22,000 per PPE. These are people who don't even make 100 shillings a day. How do you expect a patient to afford 500,000 or 1 million of bill by the time they leave that COVID center? Either the person dies of COVID or they die of debt. So even as they think about that PPE, they really need to consider the population that they have. So right. Letter or not, PPEs need to be released.
All right, so we are lucky to have Seth Panyako, the Kenya National Union of Nurses Secretary General, joining us virtually. Mr. Panyako, thank you for joining us here on KNUN Center. So we also have Dr. Gor Gode, who is also the Secretary of KMPDU Central Region. And Panyako, let me begin this conversation first by asking you about that letter that has been written when it comes to a statement on harassment and discrimination against contractual nurses. And these are the same nurses that some governors are saying they're being paid. They've not gone on strike. Panyako, we can't hear you. Kindly unmute your mic.
When the governors, county governments, and some people in the national government decided that they will hire some nurses and other health workers on dubious contracts, they are calling them contractual basis, they thought that the rights to participate in activities and programs of the trade union are waived when you're on contract. They do not even understand the definition of an employee. An employee is defined by in the Employment Act and the Labor Relations Act, as well as the Labor Institutions Act 2007, that is a person who is paid wages or salary. And therefore, the notion that contracted nurses do not have the right to champion for their rights, participate in the trade unions and join the trade unions and participate in activities and even vie for position in the trade unions are misguided by the county government. And so these threats, based on the fact that some of them are saying that the contract they signed prohibited them from going on strike, if there is indeed any letter or a contract existing that has got those terms, then it goes against the provision of the Employment Act Section 5 on discrimination, and as well as the Constitution of Kenya, Article 41. And we have written that letter to enlighten our members, to let them know that they have a right as employees in this country to take part in activities and programs of a trade union, to join a trade union, to go on strike, and to fight for their rights.
All right,
that is what we are trying to do.
But Mr. Panyako, if I may go with what your letter says, this is what you've actually stated in that letter, that in view of the above, the union wishes to strongly advise her members not to heed to these threats, to report on duty as every person employed for wages or salary is recognized in law as an employee. The same law confers the rights for employees to join and participate in activities of trade union, including going on strike. These are the same nurses you are asking to go on strike, yet the county government is saying, we have given you all that you need, so stay at work. Why would you want to have these nurses to go on strike?
They are already on strike, and these are nurses who have not been paid. And those who have been paid are being paid dubious salaries. If you pay a nurse 15,000, 25,000 for work of equal value, what are you telling us? The National Employment Policy does not allow discrimination in employment. Employment Act Section 5, Clause 5 says an employer shall ensure that workers are paid equal remuneration for work of equal value. When you put a nurse on contract and you pay 25,000, like I can refer you to a nurse who is admitted at Kakamega ICU, Kakamega Level 5 ICU, and she works in Bungoma, and in Bungoma she's being paid 25,000 shillings. What will you think that this nurse will, where do you think this nurse will get money to clear the ICU bills with the time she's through with the management? We are saying that these particular nurses do not have any medical cover. They do not have medical insurance. They don't have group life insurance. They are not getting any allowance, including house allowance, commuter allowance, all the allowances. And yet they are exposed just like any other health worker. Right. And as I'm telling you, some of them have contracted COVID-19. So this level of discrimination and holding workers in the modern day slavery and demeaning is not allowed in the Constitution. And that's why we're saying as a union, our responsibility is to fight for the rights of our members.
All right, and it's good, Mr. Panyako, I have you on board, and I also have KMPDU Central Region Representative Dr. Gor Gudi. And the reason as to why I'm saying that it's good to have both of you, it's because there is a concern by nurses, including you, Mr. Panyako, that nurses are not being treated as good, that are not being treated actually the same way doctors are being treated by the government when it comes to providing for them during this time of COVID-19. The doctors are getting better treatment from the government, the nurses are not getting that good treatment from the government. I'll start with you, Mr. Panyako.
I'm not quite sure if anything is, if there's any truth from that statement. From where I sit is that during this COVID-19, all the problems that are facing health sector are cutting across the board. If a nurse is not having comprehensive medical cover, a doctor is not having. If a doctor is not having group life insurance, a nurse is not having. So as far as we are concerned, the issue that we are raising today cut across the board. Unless there are what we call historical injustices and some of the things that have been done in Afi House, it is true that there could be other things which other cadres feel like they are not properly being treated and they believe they are strangers in the Ministry of Health. Those things are very true and we cannot run away from them. But we do not want a diversion from what we are talking about. When the issues of equality and fairness in the Ministry of Health is going to be addressed, probably this will not be the right platform at the moment.
All right, I know that you're saying this would not be the right platform at the moment, Mr. Panyako, but let me take you back to the memory lane. We had a discussion with you this week when it comes to the health, last week, not this week. Actually, it's this week, if my memory is right. And you're saying that when the president gave a directive when it comes to release of funds to the doctors, the nurses did not get that.
No, I didn't say that. Maybe I was misquoted. When the president gave the directive that COVID risk allowance be paid to health workers, and he gave directive that the Ministry of Health, together with that of the Ministry of Public Service, Gender and Youth, together with SRC, sit down and work on a formula on how these nurses and how these health workers are going to be paid. There was no inclusion of the nurses union in deciding on how much shall be paid, because we all know that when you talk about risk that is actually posed on health workers, nurses are number one. For every one case of infection in the health sector, nurses are internationally, they are prone to get at least 30 times of the normal infection. So we are the highest volume of people in terms of health sector exposed to risk, which is actually confirmed by the number of hours we spend with the patients, the number of procedures we spend with the patient, the number of times we regulate with the patient, we do counseling with the patients, we stay with the patients, we do very intimate procedures with the patient that exposes nurses more to infection, also common infection, than any other health worker. So when you pay a risk allowance, for example, to doctors of 20,000, and then you pay a nurse 3,850, honestly, that is not fair compensation. And that is not what we are discussing right now. That's why we are saying we want harmonization of risk allowance.
All right, so Doctor,
there must be some basis. There must be some basis on why decisions are made in government. They cannot just this group must get this one must be frustrated. No, there must be some basis.
So let me bring in. So Mr. Panyako, let me bring in Daktari. Daktari, you've heard what the sentiments of Mr. Panyako when it comes to that, COVID-19 allowance, the discrepancies.
Yes. Unfortunately, I can't talk much about that because those allowances were given depending on the job group that you're in. So if you're in a higher job group, then the allowance is higher. If you're in a lower job group, then the allowance is lower. And that is what they used. I think it was passed at the SRC, and they took in account all these things before they made that decision. I sympathize with him, and I understand that we go through the same kind of risk allowance, but unfortunately we have the job groups, and allowances are given according to that. And just to support him, I'd like to bring to our attention that Kenya is a signatory to the International Covenant on Economic, Social and Cultural Rights. That means that even if you're not unionized, you have a right to go on strike. So even if they get healthcare workers, nurses and doctors on very small salaries and put them on contracts so that they cannot go on strike or agitate for better healthcare, I think they need to know that this is not how we are going to stop. We are still going to fight for better healthcare. So
Daktari, you union officials of KMPD have decided to suspend your strike to give a dialogue a chance. But the nurses and the clinical officers have said, we will not give that a chance. We want our demands to be met, then we go back to work. We're not going to talk anymore. What would you like to tell the union official of the Kenya National Union of Nurses, Secretary General Seth Panyako, who's with us in this, who's actually with us in this conversation?
I'd tell him to continue fighting for their rights. It's their right, what they're asking for. It's not ridiculous. We cannot keep killing ourselves. We cannot be getting into murderous hospitals. Let them fight for their rights. Even our acting SG told them, we support their strike. Let them fight for their right. We support you.
So, Mr. Panyako, do you think there is goodwill by the government to bring this crisis to an end? Because today is day 5.
I do not want to be pessimistic, because as we are talking, discussions are going on. My acting national chair is leading my team that is negotiating with the government. And as usual, the government is speaking sweet language and having a lot of public relations exercise. But we want that public relations exercise to translate into tangible, implementable agreements. They all agree that nurses should, for example, get enhanced risk allowance, but that's what they're telling people. But we want that now to be put in writing. They agree that we need to have comprehensive medical cover. That's what they're saying, but we do not have it. They agree that we need to have personal protective equipment. We do not have it. They're sleeping, they are rotting at KEMSA. They say we need to have comprehensive medical cover, group life insurance. They agree that we need to have a health service commission, and yet the signatures have been taken to IEBC. So we want to see tangible agreements, tangible steps being taken. For us to believe that government has goodwill, but we will know whether there's goodwill or not from the outcome of today's meeting, because we don't want this strike to prolong anymore. Once an agreement is there and we are satisfied, we'll proceed. For example, the agreement on comprehensive medical insurance, as well as group life insurance. We want to see a letter from NHIF telling us money has been released to NHIF by the government to cover all health workers. And we also want to see those personal protective equipment held up at the KEMSA being released to go to the county government and all hospitals in the country, so that health workers can use them to serve the public, to protect themselves, and also to protect the general public.
All right.
It would be very unfair for me to leave this show before congratulating Dr. Goodwill. Is it Goodwill or Goodwill?
It's Dr. Gore Goody. It's Dr. Goody, Mr. Panyako.
You have done a commendable job as a trade unionist. We envy you. We are very much proud of you. We may have our own small differences as health workers, but you must know that you are one of the trade unionists we are looking upon.
All right.
Thank you.
All right.
Thank you so much. Thank you.
All right. Now, Mr. Panyako, so this is not the first time you're holding a meeting with the government through the Ministry of Labour. So if an agreement is, you have an agreement today at the end of the day, and it is signed, how immediate do you want it implemented in terms of action? Because it's one thing to write and it's one thing to implement.
First of all, we want the agreements to have the seal of authority. That agreement that will be done must be signed by all county public service boards. It must also be signed by the national government for us to be sure that it's going to be implemented. We don't want a situation where we have an agreement here at Nairobi and a county like Murang'a, because it's being led by a dictator, says that we cannot pay this. And then all the 46 county governments honor the return to work agreement, but one county government refuses and decides to frustrate their nurses in that county, like what is happening in Murang'a. So we would want to have that agreement signed, and if it is signed, even if the county governments don't sign, as long as there is a signature of SRC, that is good enough for us to go back to work.
All right. So I have only 4 minutes remaining to bring this conversation to an end, so I'd like to divide it equally between you and Dr. Gore. So, Dr. is there light at the end of the tunnel? Are you seeing like probably your strike will be called off? You'll not go on strike on the 21st of this month, because just a week, it's actually 9 days from today.
We are very hopeful from the health committees that we have been sitting with, and should they solve our issues before the end of those 9 days, we will not go on strike. And as I end this interview, I'd like to say this. When soldiers die at war, they are given state funerals and their families are taken care of. That is not the case for healthcare workers. While we die, no one is left behind to take care of our families. We are in a fight for our lives. Please take us seriously and prioritize us. Thank you.
Right, just echoing what Mr. Panyako had said this week, that families of the fallen heroes need to be taken care of. Mr. Panyako, your parting sentiments to your striking members. We want to tell our members to continue in the fight. This war is not going to be won if we have people who take 2 steps in front and 1 step back. We want to fight this war once and for all. We have been on the streets way too long. And once we go on the streets, the poor Kenyans suffer. Those are our parents, they're our sisters, they're our brothers. So I call upon all nurses to go out. If you have not yet joined the strike today.
so that the impact should be more than what it is today for those who matter to take cognizance of that and address these issues so that we have a collective bargaining agreement in place that can keep us at peace with our employers as well as the public for at least a period of 4 years.
All right, Mr. Panyako, the Kenya National Union of Nurses Secretary General has joined us virtually having this discussion about the welfare of health workers, the nurses here in the country who are on a strike day 5 today, and Dr. Gorgudi, I got it right, Gorgudi, the Secretary for KMPDU Central Region. I'd like to say Daktari and Mr. Panyako, asanteni sana for joining us here on KTN News Center. Another short commercial break. I'll be right back with more making the headlines here in the country and beyond our borders during the second hour at 10 a.m.